The SENOMIC Trial. Welcome to the Everything Surgery podcast, where we dissect the extraordinary in medical science. Today, we are delving into the SENOMIC Trial, a pivotal Swedish prospective cohort study that has shaped the management of breast cancer with sentinel node micrometastasis. To begin, the SENOMIC Trial, formally titled Sentinel Node Only versus Major Axillary Clearance in Breast Cancer with Sentinel Node Micrometastasis, set out to address a crucial question. Is it safe to omit completion axillary lymph node dissection in patients whose sentinel lymph nodes reveal only micrometastasis or isolated tumor cells? Conducted in Sweden, this population-based study followed over 1,300 women diagnosed with early-stage breast cancer. The focal point was women whose sentinel lymph nodes contained tumor deposits between 0.2 mm and 2.0 mm, or isolated tumor cells with deposits smaller than 0.2 mm. All patients were treated according to evolving national guidelines, which, during the study period, moved away from recommending axillary lymph node dissection for this subgroup. The study compared two groups. The first group underwent only sentinel lymph node biopsy, a less invasive procedure. The second group received the traditional completion axillary lymph node dissection after a positive result in the sentinel node. The investigators closely monitored overall survival and axillary recurrence, meaning the return of cancer in the armpit area, over 5 years of follow-up. What did the SENOMIC trial reveal? The findings, published in the British Journal of Surgery, were both reassuring and practice-changing. There was no statistically significant difference in overall survival between those who had only the sentinel lymph node biopsy and those who underwent the more extensive axillary lymph node dissection. Furthermore, the rate of recurrence in the axillary region remained very low and was not significantly different between the two groups, with a recurrence rate of 0.4% in the group without axillary lymph node dissection and 0.2% in the group that had the procedure. Perhaps most notably, patients who did not undergo the extensive surgery experienced a dramatically lower incidence of lymphedema, which is swelling of the arm, a common and often debilitating complication of axillary lymph node dissection. The reduction in arm morbidity led to a significant improvement in quality of life for these patients. In conclusion, the SENOMIC trial provided robust evidence that for breast cancer patients with sentinel node micrometastasis, omitting completion axillary lymph node dissection is a safe practice. It does not compromise survival or disease control, and it markedly reduces the risk of chronic side effects such as lymphedema. These results, alongside other contemporary studies like the International Breast Cancer Study Group 2301 trial, have helped change clinical guidelines. The move towards less radical axillary surgery is now supported by real-world data demonstrating that the risks of major surgery outweigh its theoretical benefits for patients with minimal nodal disease. Thanks for tuning in. If you find this content insightful, please like, share, and subscribe. This has been the Everything Surgery podcast, where we bring you the latest evidence and dissect the extraordinary.